সুপ্রিয় দর্শক, শুরু করছি দেশ টিভির সরাসরি এবং নিয়মিত স্বাস্থ্য বিষয়ক সম্প্রচার নিউট্রিচ ডায়াবেটিক বিস্কিট গুড হেলথ অনুষ্ঠানটি। আপনার স্বাস্থ্য এবং স্বাস্থ্য সংক্রান্ত যে কোনো সমস্যা এবং তার সমাধান নিয়ে প্রতি শুক্রবার ঠিক এই সময়ে আপনাদের সাথে থাকছি আমি ডাক্তার মলি, এবং আমাদের সাথে থাকছেন একজন বিশেষজ্ঞ ডাক্তার। আমাদের আজকের বিষয় স্ট্রোক। এই বিষয়টি নিয়ে কথা বলবার জন্য আমাদের সাথে আজকে স্টুডিওতে উপস্থিত আছেন ডক্টর হরিপ্রকাশ চক্রবর্তী, ডিপার্টমেন্ট অফ নিউরোসার্জারি, জেড.এইচ শিকদা উমেন্স মেডিকেল কলেজ অ্যান্ড হসপিটাল। সুপ্রিয় দর্শক, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 8332509 8332754। দর্শক, আমি আবারও বলছি, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 8332509 8332754। গুড মর্নিং হরিপ্রকাশ।
Good morning, Molly. Good morning. Thank you, Desh TV, for inviting me here.
It is our immense pleasure to invite you in our today's show. We have selected our today's topics is stroke. So coming to that point, I want to know on behalf of audience that what stroke is. Actually, we know what is stroke in common sense, but what stroke means in a medical science, we want to know from you.
Stroke is something similar to what happens in the heart. Stroke happens in the brain. So it's basically like a heart attack. You know, in the heart, when there's a block in the vessel, there's a portion of the heart that doesn't get blood and it dies. Something similar happens
Proper
in the
oxygen
brain.
supply.
Correct. And something similar happens in the brain. There are two types of stroke. One is once there's a bleeding, or if there is a stop of blood to the brain.
There's
So
two
there
type of stroke.
Correct.
One you are saying for the due to bleeding and
Yeah.
due to less of oxygen supply.
Correct.
We generally we called it hemorrhagic stroke and hypoxic stroke.
Correct. That's
Okay.
right.
Coming to that point, if you are a neurosurgeon, so coming to that point, I want to know that about the bleeding purpose and the lack of oxygen supply. What is the reason of the two things?
Yeah, the most common type of stroke is the bleeding type. You know, the bleeding type of stroke. It happens in 80% of the population, and the most common reason for the bleeding is hypertension. Uncontrolled hypertension is the most common cause. The second that comes is the smoking. People who smoke cigarettes for a very long time and a prolonged period, they develop stroke. That causes damage in the blood vessels, and the blood vessels break, and that causes bleeding in the brain. And there are other
That means you are saying that 80% stroke is due to bleeding.
Correct.
I mean, this is the commonest type of stroke.
presentation.
Okay.
That's right.
And it occurs due to hypertension and the lifestyle due to smoking.
Correct.
This type.
That's right. Yeah. And the other 20% is because of blockade. And the blockade also, the most common cause is smoking. Smoking and having very high fat food like high cholesterol,
High cholesterol food,
lipid,
rich food.
oil, and meat, red meat in particular, and oil, the one that they use, saturated fatty acids.
In general, if we become obese, I mean,
Correct.
due to this type of food and cholesterol level is high, then it is one of the another reason.
Correct.
Okay.
That's right. Yeah. And there are other reasons for stroke, you know, because the commonest is around for the bleeding that we, as we said, is because of hypertension and smoking. But there are other problems like, you know, that is because of the, you know, development, or there is a anomaly, like there is a problem in the blood vessels. So the problems that happen in the blood vessels is something called an aneurysm. So aneurysms are small swellings in the vessels, and they break. That also causes bleeding. And the second, the other one is the
And can
aviums.
you tell the reason that what are the causes of aneurysm?
Aneurysm again is mainly because of one is the congenital, like, you know, they have a predisposition for forming aneurysms, like a family history will be there. And the other is the region, like the regional predisposition, like, you know, the part of Bangladesh and this part of the continent, the Orient, where the east part has got more patients who develop aneurysms. It's because of their genetics.
Okay.
Okay.
That means you are saying that aneurysm, which later on causes for bleeding of causes, it is one of the reason for the country situation that
Correct.
the orientation, this orient people have this for genetic reason.
Correct.
Another, okay.
Genetically, the Bangladeshi, the Bengali belt, and the the Taiwan or the Thailand, all this East people will have more predisposition for developing aneurysms.
Aneurysm, okay.
Yeah. And smoking also causes aneurysms. The other one, as I told you, is arteriovenous malformations. There are also type of disorders of the blood vessels that can also bleed and cause stroke.
Okay.
Yeah.
Okay. I will coming to the point. At first, I have to take a phone. Okay. হ্যালো দর্শক, আপনার নাম বলে প্রশ্নটি করুন।
ওয়ালাইকুম আসসালাম আপু, আমার নাম মোহাম্মদ সাদ্দাম হোসেন, আমি মুশফিক থেকে বলতেছি।
জি, আপনি প্রশ্নটি করুন, আমি শুনতে পাচ্ছি।
আচ্ছা আপু, আমার প্রশ্নটা হচ্ছে আমি দুইবার স্ট্রোক করা হয়েছে আমার, মানে একবার হইতেছে গিয়া 2012 সালে, আরেকবার হইতেছে 2016, মানে 3-4 বছর ফারাক আর কি। তো আমি ডাক্তার দেখাইছি, উনি আমি মাথার ব্রেনে ডাক্তার দেখাইছি, আমার এই সিটি স্ক্যান করছে আর ইজিটি করছে আর কিছু রক্তের ব্লাড পরীক্ষা করছে। ওই সিটি স্ক্যানের মধ্যে আর ওই ইজিটির মধ্যে কিছু সমস্যা দেখা দেয় নাই, কিন্তু আপনার রক্তের কোলেস্টেরল অনেক হাই, 260 প্রায়। আর আরেকটা জিনিস পাইছে হইলে গিয়ে আপনার ডায়াবেটিস 8-এর মতো আছে আর কি। তো এখন এখানে কি স্ট্রোকগুলো হওয়ার কারণ কি ডায়াবেটিস থেকে, রক্তের কোলেস্টেরল থেকে, নাকি অন্য কোনো কারণ থেকে?
Okay. The patient is asking that he had gone through 2 stroke. One is in 2012 and 2015, and the doctor said due to high cholesterol it happens. So he wanted to ask that it happens due to diabetes or hypertension or due to high cholesterol level.
So as I told you, there are multiple factors for stroke to develop. As the doctor has already informed, the high cholesterol and diabetes, all of them contribute to forming
Collectively,
stroke. Yeah, collectively.
the reason of
Yeah,
stroke.
and
Okay.
even the hypertension, smoking. So if they have multiple problems, then they have a higher chance of developing stroke.
Okay.
So they will have to drastically change their lifestyle. Otherwise, it
To
they can
lowering
have,
the cholesterol
correct,
level.
Correct.
দর্শক, আমাদের সাথে যিনি রয়েছেন ডাক্তার, উনি আপনাকে সাজেস্ট করছেন যে আপনার হাই কোলেস্টেরল লেভেলের জন্য যদি আপনার স্ট্রোক হয়ে থাকে তাহলে আপনার লাইফস্টাইল মডিফিকেশন করতে হবে, জীবনযাত্রার মানটাকে আপনার পরিবর্তন করতে হবে এবং কোলেস্টেরল লেভেলটাকে আপনার কমিয়ে আনতে হবে। সেক্ষেত্রে আপনার পরবর্তীতে স্ট্রোক হওয়ার চান্স কমে যাবে, যেহেতু অলরেডি আপনার 2বার হয়েছে। পরবর্তীতে যদি না হয় সেটার জন্য আপনাকে কোলেস্টেরল লেভেলটাকে কমাতে হবে। দর্শক, অনেক ধন্যবাদ আমাদের প্রশ্নটি করার জন্য। স্যার, উই ওয়ার টকিং অ্যাবাউট দ্য রিজনস অফ stroke and what are the another reason the patient was called that says the diabetes. Is diabetes is one of the factor associating
Yes,
of stroke?
yes, it is a contributing factor for developing of stroke. Yes.
Okay. Because due to diabetes, later on the patient become hypertensive and the
Correct.
other problems.
They are all interrelated.
Okay,
The
fine.
hypertension.
Okay, and then I want to know about what are the sign symptoms of you said the 80% people have stroke due to bleeding. So what are the sign symptoms of hemorrhagic stroke, this type of stroke?
Yeah. The first and foremost thing is that patients suddenly, it's basically a sudden onset, like it happens suddenly. The patient will be all right, but they start suddenly feeling some sort of a weakness.
Okay.
Either they, the weakness
Is
can
it
be
a differentiating point of hypoxic stroke?
Yeah, initially you cannot really
Okay,
differentiate unless you
Okay,
do a scan.
Okay.
The stroke is basically considered a stroke unless we investigate.
Okay.
So they will not be able to really differentiate
Okay,
in as a person at home.
Okay.
So as I told you, the stroke happens as a sudden phenomena. It happens like a thunder. It happens immediately. So a patient starts having symptoms like they have when they smile, you can see the face goes a little sideways, like
Kind of
they
a
have
facial nerve palsy.
facial nerve palsy.
Yeah.
And they might have weakness in the hands. They might have a little weakness, and the legs might be weak. They might not be
They
able
are not
to get
able
up.
to hold anything or catch
Correct,
anything.
correct. And they might not be able to get up from their sitting position.
Yeah.
So initially that is what they feel, and gradually over a period of 1 or 2 hours, this progresses and they develop a frank stroke.
Okay.
So whenever the patient recognizes that there is some sort of a weakness, because a lot of people
They are not they are not able to do the normal
Correct.
things, normal
Yeah,
activities.
Correct. Unfortunately, what happens is this kind of, when it starts, people neglect it. They're thinking, okay, maybe there is some weakness. I might drink a little bit of a juice
Okay.
or something. It will become all right.
Or I
But
didn't
that
sleep
doesn't.
well, or I
Correct,
didn't take
correct.
food properly.
That's
but
exactly.
by this time the stroke symptoms is
Yeah, it
increasing
is
gradually.
developing. So the period in which it develops is 3 to 4 hours. In that 3 to 4 hours, when the fully stroke happens, then we
Then
will
patient
not
came
be.
to know that
Yeah.
something happened.
Correct.
Okay, I will come to know the point after taking a short break, that what is the investigations we done for confirming that what is it happens for due to bleeding or due to lack of oxygen supply. Before that I am taking a break. সুপ্রিয় দর্শক, নিউট্রিরিচ ডায়াবেটিক বিস্কিট গুড হেলথ অনুষ্ঠানের এ পর্যায়ে সময় হয়ে এসেছে ছোট্ট একটি বিরতি নেবার। বিরতির পর ফিরে আসছি, থাকবেন আমাদের সাথে। সুপ্রিয় দর্শক, বিরতির শেষে আবারও ফিরে এলাম নিউট্রিরিচ ডায়াবেটিক বিস্কিট গুড হেলথ অনুষ্ঠানটিতে। আমাদের সাথে থাকার জন্য ধন্যবাদ। আপনার স্বাস্থ্য এবং স্বাস্থ্য সংক্রান্ত যে কোনো সমস্যা এবং তার সমাধান নিয়ে প্রতি শুক্রবার ঠিক এই সময়ে আপনাদের সাথে থাকছি আমি ডাক্তার মলি, এবং আমাদের সাথে থাকছেন একজন বিশেষজ্ঞ ডাক্তার। আমাদের আজকের বিষয় ছিল স্ট্রোক। এই বিষয়টি নিয়ে কথা বলবার জন্য আমাদের সাথে আজকে স্টুডিওতে উপস্থিত আছেন ডাক্তার হরিপ্রকাশ চক্রবর্তী, ডিপার্টমেন্ট অফ নিউরোসার্জারি, জেড.এইচ শিকদার উইমেন্স মেডিকেল কলেজ হসপিটাল। সুপ্রিয় দর্শক, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 8332509, 8332754। দর্শক, আমি আবারও বলছি, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 8332509, 8332754। Thank you, Hari Prakash. Coming to the point, we were discussing about what is stroke and what are the reasons of stroke and types of stroke and what are the sign symptoms. So, if we forward these topics into investigations, that in case of Bangladesh, people doesn't believe in doing the perfect investigations, and if it is costly, then they avoid the situation. So, it is how much it is important in case of stroke patients, that what are the investigations we do and why we do.
As I told you initially, that when the patient starts developing this sort of a weakness, and we have a time period in which the stroke has to be treated. So first thing is that the patient should and go to a hospital immediately.
When he or she feels the
Little weak,
situations that
yeah,
they
correct.
are not doing the cannot able to do the normal activities,
correct.
so immediately they should go to the hospital, because in case of stroke it is so important to the immediate treatment.
Correct.
Okay.
We have a duration of 4 hours in which we have to treat the patient, and the treatment should be successful in that 4 hours. If it goes beyond that 4 hours, our treatment will become ineffective.
Okay.
The patient will become like, he'll be disabled for
So
life.
time period is important, that you are saying that
very important.
after 4 hours it becomes more difficult for the surgeon or the doctor to treat the patient.
And even if we treat, it becomes a waste. So the patient, as soon as they recognize the problem, they should come to the hospital. And once in the hospital, if you go to a properly equipped hospital, they will immediately do a CT scan. That is absolutely essential to do a CT scan as soon as they go to the hospital. Because
Okay.
if you
So you are saying that of a stroke patient, in case of a stroke patient, it is very much necessary to come in time, before 4 hours when they are feeling the problem, and also the CT scan.
Correct.
Okay.
Yeah, once the CT scan is done, only we will be able to do further treatment. The reason is that, as I told you, there are 2 types of stroke. One is there can be a bleeding, the other is there's a blockade.
Yeah.
So if you want to treat each one, it is different, because if there's a block, we have to remove the block.
Okay.
If there's a bleeding, we have to stop the bleeding.
Yeah.
So the treatment is totally different and opposite.
Okay.
So if you want to concentrate and know what has to be done, we
If
have to do
there is a
scan.
blockade, we have to remove the blockade, and
Correct.
if there is bleeding, what is the commonest form, you have to stop the bleeding. So different procedure you have to take the decision to take. Okay, we are discussing more about this. I have to take a phone. হ্যালো দর্শক, আপনার নাম বলে প্রশ্নটি করুন।
জি, আমি গুলশান থেকে রানা বলছিলাম।
জি স্যার, শুনতে পাচ্ছেন, আপনার প্রশ্নটি করুন।
আমি গুলশান থেকে রানা বলছিলাম। আমি জানতে চাচ্ছিলাম যে স্ট্রোক করার পরে মানুষ কি করণীয়?
আচ্ছা,
স্ট্রোক হয়ে যাওয়ার পরে কি করণীয়?
জি, আমরা উত্তরটি নিচ্ছি, আপনি সাথেই থাকুন। হি ইজ সেইং দ্যাট হোয়াট হি উইল ডু আফটার ডুইং ইমিডিয়েট অ্যাকশনস অফ আফটার ডুইং স্ট্রোক। We are discussing about the
Correct.
things.
That's exactly that's what we are discussing. The only thing that you can do is, if he or someone is there, if he develops a stroke, if he sees weakness, please do not neglect it. Do not neglect it. Once you start neglecting and think that this stroke is something, some sort of a weakness, and take some local medications, try to take some juice
Food
or
or,
food or something, they'll be losing time unnecessarily by just waiting. So initially it is always best to go to the hospital where a qualified doctor is there who will be able to take care of the situation, and let them not treat
Waste of-
themselves.
okay.
Treat themselves.
and waste of time.
Correct. That is it.
দর্শক, স্ট্রোকের পরবর্তী যে নির্দেশনাটি ডাক্তার দিয়েছেন, তিনি বললেন যে ইমিডিয়েটলি আপনার স্ট্রোক যদি আপনি ফিল করেন যে আপনার কোনো বডির কোনো অংশ উইক ফিল করছেন বা আপনি আপনার নর্মাল অ্যাক্টিভিটি করতে পারছেন না, ইমিডিয়েটলি সেটাকে ইগনোর না করে, অবহেলা না করে নিকটবর্তী কোনো হাসপাতালে যে ডাক্তার শরণাপন্ন হয় এবং খুব তাড়াতাড়ি একটি সিটি স্ক্যান করা। দর্শক, অনেক ধন্যবাদ আমার সাথে প্রশ্নটি করার জন্য। উই আর টকিং অ্যাবাউট দ্য প্রসিজিওর অফ to remove the blockade and the stop of bleeding, the different procedure.
Correct.
So you take the decision by doing the investigations, or
Correct.
only by the CT scan you can decide?
Yeah, the CT scan is the primary investigation that guides us through what has to be done, and the rest of the blood investigations also we have to do before we start the treatment. And that set of blood investigation, we have to see how the blood is clotting, how well the, what is the other parameters also we have to check, because
What are the actual cause why
Correct.
the blood is why the bleeding is occurring?
Correct,
Okay.
correct. So those things we'll have to see, and as I told you, the qualified doctor will be able to assess what it is because we will have a practice and we know because of these are the possible causes. If it is hypertension, then we'll have to start controlling the hypertension. If the BP is not controlled, the bleeding keeps on happening. So immediately we'll have to take the patient to the ICU and start treating him. We should reduce the BP first, and then we'll start giving medicines to stop the bleeding.
Okay. So you are saying that in case of hemorrhagic stroke due to which occurs due to bleeding, we have to stop the causes of bleeding and stop the bleeding first. And
Correct.
if the patient is hypertensive, which is the common causes of
Correct.
bleeding stroke, we have to reduce the blood pressure level. Then
Yeah.
we will treat accordingly.
Correct.
Okay. So in case of hypoxic stroke or blockade, what you prefer to do?
In ischemic stroke, we have the first line of treatment is we try to break the clot.
Okay.
So there is a lot of injections that we get, something called altipase, that will dissolve the clot immediately, and that injection we give. The problem is that when the patient comes to the hospital, they do not have enough money or they have financial problem. The cost of the injection itself is quite expensive.
Quite expensive.
It costs around 60,000 taka.
Okay.
So, but unfortunately, we will have to give it immediately.
Okay.
So that is when it will start dissolving the clot. In this kind of procedure, when we give an injection through a small IV line in a peripheral line and try to break it, we have
Clot
a
become dissolved.
yeah.
Okay.
The success rate we have is approximately around 60%.
Okay.
So in 60% of the patients, we can probably dissolve the clot, and we can make sure the brain is getting blood again and oxygen.
Okay. I have to ask you that if a patient had gone through hemorrhagic stroke, if there is any chance to it happens again, hemorrhagic stroke or the
Correct.
hypoxic stroke, yeah.
Yeah, in hemorrhagic stroke, the initial 72 hours is very critical because the bleeding can keep on increasing. So the 72 hours we keep monitor the patient very carefully
In
in the
ICU,
Yeah,
okay.
and if the bleeding increases beyond a certain limit, we'll have to operate.
Okay.
And in certain other types of stroke, like bleeding happening because of there's a problem in the blood vessel, as I told you, aneurysms and arteriovenous malformations. So if these
Or any kind of trauma.
yeah, trauma can happen, but
Yeah.
usually we do not consider trauma as
Okay.
a part of stroke.
Okay.
Yeah. So if there is a anomaly in the blood vessels, so that has to be treated, because in these patients they have a
I mean, if we don't
rebleed-
treat that perfectly or properly or in time, then there will be another chance of getting another stroke.
correct.
Okay.
And unfortunately, in sorts of aneurysms, which is quite common in Bangladesh, in this region, if aneurysm re-ruptures, the patient will die.
Okay.
So there's a very high mortality rate in rebleeds with patients who have aneurysm. So
Okay.
that has to be investigated and treated early.
So, in
Yeah.
case of aneurysm, it have the patient and the doctor both have to be careful to
Very
treat the the things, because aneurysm due to it will lead to death.
Correct.
Okay, fine. Then I want to ask you that what are the procedures you usually do in Bangladesh, and what kind of success rate you have gotten in the few years that after doing the surgery?
The
Do you want to show some picture?
yeah,
with us?
definitely.
Okay.
In a stroke, the best part is that if we treat the patient in time, we have a very good success rate. Okay, and
If they come before 4 hours,
yeah,
and immediately if you if we
Yeah.
do the CT scan and
Correct.
diagnosis what type
Correct.
of stroke he had
Yeah.
gone through or she had gone
Yeah.
through, then according to if we treat, then it is the success rate is
very
good.
high, and
Okay.
it's very gratifying. Patient can go back home walking,
Okay.
not on the bed.
Okay,
So
okay.
that is the best part of it. So, but for that everything should fall in place. So I'll show you some slides of what all is available right now. There are newer techniques that are there that I as a neurosurgeon and endovascular surgeon practice. So I'll just show you those things. So you can focus it here. Yeah. Yeah, this is a patient with an early stroke.
Okay.
Yeah, and the patient when he comes here,
Can
he
you tell me the time of that stroke had happened within 4 hours?
yeah, this
Okay,
is within
okay,
4 hours.
okay.
This is within the 4 hours. See, the patient when he came here, we did a scan here. There's no bleeding in the brain. Okay, it's a clear scan.
Okay.
And when the patient came here, the only thing that we could find out was there's a small vessel that is little white here. So that is blocked.
Yeah.
So that is the vessel that was blocked, and we see here.
So it's a,
Yeah.
a picture of ischemic stroke.
Correct. This is a
Okay.
picture of
And
ischemic
ischemic stroke, we find the white marks, and
Yeah.
in case of hemorrhagic stroke, we find the black
blood.
marks.
Yeah,
Okay.
correct.
Okay.
Yeah, yeah. And once the block we saw, immediately we did a MRI because it is available there.
Okay.
So once we did, we could see there's a small portion of the brain here that is not getting blood supply. Okay, so you can see here we did an angiogram also. So once you do the angiogram, you can see here this side of the cursor where I'm moving
Okay.
is the normal vessel.
Okay.
The blood is nicely flowing on this part of the brain. This is on the left side. On the right side, there's a block. There's no blood vessel seen. So this is a block.
And this
So-
is the reason of that
Yeah,
stroke. Okay.
correct. So in these patients, what we do, we did a clot retrieval system, like we did a mechanically. We went through the. What we exactly do in this sort of a situation is as I told you, we give the injection to break the clot.
Yeah.
But as I told you, the
To dissolve
success
the
rate,
clot,
yeah,
okay.
yeah, the success rate is not very high. As I told you, it's around 50 to 60% approximately. But in rest of the 40 to 50% of the patient, it doesn't open it up.
Okay.
So,
So I want to ask you something, that is there any age-related situation of this type of strokes? In which age it happens more concurrently? We will
Yeah,
discuss
correct.
about the topics after taking a break.
Sure.
Okay. সুপ্রিয় দর্শক, নিউট্রিরিচ ডায়াবেটিক বিস্কিট গুড হেলথ অনুষ্ঠানের এই পর্যায়ে আবার সময় হয়ে এসেছে ছোট্ট একটি বিরতি নেবার। বিরতির পর ফিরে আসছি, থাকবেন আমাদের সাথেই। সুপ্রিয় দর্শক, বিরতি শেষে আবারও ফিরে এলাম নিউট্রিরিচ ডায়াবেটিক বিস্কিট গুড হেলথ অনুষ্ঠানে। আমাদের সাথে থাকার জন্য ধন্যবাদ। আপনার স্বাস্থ্য এবং স্বাস্থ্য সংক্রান্ত যে কোনো সমস্যা এবং তার সমাধান নিয়ে প্রতি শুক্রবার ঠিক এই সময়ে আপনাদের সাথে থাকছি আমি ডাক্তার মলি, এবং আমাদের সাথে থাকছেন একজন বিশেষজ্ঞ ডাক্তার। আমাদের আজকের বিষয় ছিল স্ট্রোক। এই বিষয়টি নিয়ে কথা বলবার জন্য আমাদের সাথে আজকে স্টুডিওতে উপস্থিত আছেন ডাক্তার হরিপ্রকাশ চক্রবর্তী, ডিপার্টমেন্ট অফ নিউরোসার্জারি, জেড.এইচ শিকদার উইমেন্স মেডিকেল কলেজ অ্যান্ড হসপিটাল। সুপ্রিয় দর্শক, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 83325098, 83325754। দর্শক, আমি আবারও বলছি, আপনারা চাইলে সরাসরি ফোন করে কথা বলতে পারেন আমাদের আজকের বিশেষজ্ঞ ডাক্তারের সাথে। আমাদের ফোন নম্বরগুলো হচ্ছে 83325098, 83325754। Prakash, we were talking about the procedure we usually do in case of ischemic stroke, and you were seeing some picture to us. So,
Yeah.
coming to that point, you were saying that there are some new technologies we are using.
Correct.
Can you explain that? What are the technologies we are using?
I'll just show it to you. It's a small video. You can see it here. So once the blood vessels are there. So in the blood vessels, there's a block that happens here. Okay,
Yeah.
there's a small block, and once the block happens, we have to remove the clot. So what we do is we put a wire through
Okay.
the vessels.
Wire.
Yeah,
It
wire.
is called wire.
Yeah,
Okay.
yeah, and then we put a catheter through
Okay.
that, and then we advance a stent there.
Okay.
It's something called a stent retrieval system.
Okay.
So this is a stent. Once the stent is put, the blood clot is pushed to one side, and the
Okay.
blood starts flowing into the brain.
Okay.
So and then we pull the stent along with the clot.
Okay.
Yeah, and we just pull it out.
Okay.
So in this kind of a
Can you
system,
tell me what is the name of this procedure of new technique?
it's called a stent retrieval system.
Stent
Yeah,
retrieval system.
mechanical thrombectomy or a stent retrieval system.
দর্শক আমি একটু বলতে চাচ্ছি আপনাদেরকে যে স্যার আমাদেরকে যে বিষয়টি শেয়ার করলেন যে আমরা আসলে দুই ধরনের স্ট্রোকের ট্রিটমেন্ট করে থাকি। একটা হচ্ছে আমরা যখন ব্লিডিং এর কারণে স্ট্রোক হচ্ছে সেটা এক ধরনের চিকিৎসা, এবং যখন ল্যাক অফ ব্লাড সাপ্লাই, যখন ব্লাড সাপ্লাই কমে যাচ্ছে ব্রেনের কোনো একটা অংশে, তখন যে ব্লকেটটা হচ্ছে সেটা থেকে আমরা অনেক সময় স্ট্রোকে সম্মুখীন হই, এবং সেক্ষেত্রে আমরা এক ধরনের ট্রিটমেন্ট করে থাকি। এবং আমাদের এই টেকনোলজিটা নতুন এসেছে যে আগে আমরা ডিজলভিং ম্যাটেরিয়ালস দিয়ে বা ওষুধ দিয়ে ওই ব্লাড কটটিকে সরিয়ে দিয়ে আমরা ট্রিটমেন্ট করতাম। এখন আমরা নতুনভাবে স্ট্যান্ট রিট্রাইভিং ট্রিটমেন্ট করছি, যেটা স্ট্যান্ট আমরা যদি ঢুকিয়ে দিই আমরা ব্রেনের ওই ব্লাড ভেসেল, এবং তাকে আমরা সাক করে নিয়ে আসি। অনেক সময় দেখা যায় যে ক্লটগুলোকে ডিজলভ করা থেকে ওই সাক করে নিয়ে আসার টেকনিকটা আসলে বেশি ভালো কাজ করছে, এবং এটা খুবই নিউ টেকনোলজি, এবং এই টেকনোলজিটা আসলে আমাদের দেশে এখন চলে এসেছে। এই বিষয়টি নিয়ে আমরা কথা বলছিলাম। আর দর্শক একজন লাইনে আছে স্যার, আই ওয়ান্ট টু টেক এ ফোন কল। ওকে, হ্যালো দর্শক, আপনার নাম বলে প্রশ্নটি করুন।
আচ্ছা,
দর্শক আপনার টিভির ভলিউমটি কমিয়ে দিয়ে প্রশ্নটি করুন।
আচ্ছা, আমি রাশিদা।
জি।
আমার 55 এজ। তো আমার অক্টোবর মাসে ব্রেনের এমআরআই করা হয়েছে। তো এই রিপোর্টে অসংখ্য ছোট ছোট ইনজুরি। তো আমার দুবার স্ট্যান্টিং করা হয়েছে, 9 সালে একবার, আবার এই গত বছর নভেম্বরের 14 তারিখে একবার। ঘাড়ে একটা ব্লক ছিল, তারপরে এই করোনারি ব্লক, হ্যাঁ, আগের তো আবার ব্লক। এখন এই যে ব্রেনে যে ইনজুরি, এটা কেন হলো, কি জন্য হলো, এটা একটু জানতে চাচ্ছি। আর মানে
পেশেন্ট আপনার কি ব্লাড প্রেশার কি কোনো সমস্যা আছে কিনা, ব্লাড প্রেশার বেশি কিনা?
হ্যাঁ হ্যাঁ হ্যাঁ, আমার বিপি ফ্ল্যাকচুয়েট।
ওকে,
ডায়াবেটিস আছে।
আপ ডাউন করে, বিপিটা আপনার আপ ডাউন করে? আচ্ছা, ডায়াবেটিস আছে আপনার?
জি, ডায়াবেটিস আছে। এই আর কি।
আচ্ছা, আমরা উত্তরটি নিচ্ছি স্যারের কাছ থেকে। পেশেন্ট ইজ সেইং দ্যাট শি ইজ 65 years old, had gone through a coronary blockade, and the doctor did the MRI, and they found severe injuries in the brain vessels, and she had fluctuating blood pressure level, ups and downs, and also diabetics. So she wants to know that what are the reasons of that blood vessel injury in the brain. Is due to occurs due to of the coronary blockade or something related
Correct.
to that?
The blockade that happens in the heart and in the brain, the causes for it are the same, very similar. Like she doesn't have, she has got a fluctuating BP,
Okay.
it causes damage to the blood vessels. Diabetes causes, and high fat levels. So these are the three probable
All of the
causes
causes are related to the
heart.
injuries. Okay.
Yeah, the same that causes problems in the heart can cause problem in the brain as well, because it's all the blood vessels.
Yeah.
So Raktanols are all the same. So the same kind of a damage happens in the brain also.
Okay. So if you want to suggest that to what she will do to decrease the blood pressure level or lifestyle modification?
One very important thing I would always suggest most of the people who are around the 60s or 65 is that every doctor would always suggest to have diet which is low salt, less salt, and to change like food habits and other things. But unfortunately, ladies do not follow exercise.
Okay.
Exercise is one very important thing that would reduce your risk for heart attack and brain attack, both. So if any person is there,
And also will compensate the diabetes and hypertension and the obesity problem, which is leading cause
correct,
of
exactly.
stroke.
Yeah. And most of these diabetes, hypertension and stroke, heart problems are all mainly because of our lifestyle, because we are eating and we are sitting at home and we do not do exercise. In olden times this was not the case, because people who are working, they keep working and
Okay.
in a farm and other things. So when they are doing
Nowadays,
that,
all
yeah,
become sedentary workers.
Correct.
They work in a
Yeah.
sitting posture or sitting
Yeah,
manner.
correct.
Okay.
So either at home. So the one way to keep themselves occupied is they have to do at least some 45 minutes of walking.
Okay.
And I always suggest to do a brisk walking.
Okay.
It should not be a lazy walk, because if you do a small slow
Okay.
walking, it doesn't increase the heart rate.
Heart rate.
It should, the
So
heart
to
rate should,
do fast walking. I mean, as we work normally, it should be a little bit fast and
walking. The
okay.
breathing should become little heavy. The heart rate should go up. So if they do that like that for 45 minutes, at least 4 times a week,
Okay.
at least 4 times a week, most of the problems will become all right.
দর্শক আমাদের স্যার যিনি আছেন ডক্টর আমাদের সাথে, স্যার বললেন যে আপনি যদি আপনার লাইফস্টাইলটাকে কিছুটা মডিফিকেশন করেন, জীবনযাত্রার মানটাকে কিছু পরিবর্তন করেন, যে আপনার করোনারি ব্লকের থেকে আসলে ব্রেনের এই ইনজুরিগুলো হয়েছে, এবং সেক্ষেত্রে ব্লাড প্রেশার, ডায়াবেটিস একটি বড় কারণ, এবং এগুলোকে কমিয়ে আনার জন্য আপনার করতে হবে সবচেয়ে বেশি যে জিনিসটি, সেটা হচ্ছে এক্সারসাইজ, এবং আপনার খাবার দাবার হাই রিচ ফুড, এবং এগুলো একটু অ্যাভয়েড করতে হবে। আপনি যদি লাইফ স্টাইলটাকে মডিফিকেশন করতে পারেন, যে জীবনযাত্রার মানটিকে একটু ফিজিক্যাল অ্যাক্টিভিটি করে, একটু শারীরিক পরিশ্রম করে, তাহলে এই জিনিসগুলো কমে আসবে, আপনার ডায়াবেটিস এবং হাইপারটেনশন, সেই সাথে আপনার এই চান্স অফ আপনার যে ব্লাড ভেসেলের যে ইনজুরি হয়েছে ব্রেনে, সেগুলোও কমে যাবে। দর্শক অনেক ধন্যবাদ আমাদের প্রশ্নটি করার জন্য। হরিপ্রকাশ, উই আর হ্যাভ অনলি 5 minutes, so we want to ask you something different, that any treatment procedure you want to share with us.
Yeah, as I told you that I am a neurosurgeon and I practice endovascular surgery.
yeah.
So this one, the one that I showed you, was something.
I want to ask you that the newer process you said, that stanting retrieving, is it successful in here, and you have done these cases?
Here the cost is prohibitive.
Yeah.
The problem is if you want to do
This is so much high cost.
if you want to do a stent retrieval,
Okay.
the cost is around 2.5 lakh taka.
Okay.
So but it is worth it, because you will, if you do that, if the patient walks back, that is
Okay.
the biggest gift that we can give it to a gift, a
Yeah.
patient, rather than patient is going to be a burden for the family for the rest of the life.
Yeah.
So I would always suggest to go with that rather than this, not treating the patient. And there are other techniques, as I told you. This is the stent retrieval technique, where we remove the clot, where we did that.
Okay.
And see, we can see that after the retrieval, the the
This is
stroke
the
is,
scenario after treating the patient.
yeah,
Okay.
yeah. The stroke is very it's very less here. It is not
Yeah.
a big stroke.
Okay.
We can control the stroke.
Okay.
Okay. And if we don't treat, as I told you, the patient might end up having a very large stroke with maybe even they die because of that. And these are all the ways, the bleeding, how we treat with surgery. And as I told you, aneurysms, when they cause bleeding, they cause subarachnoid hemorrhage. In these patients, we can see that this is a blood vessel. This is the blood vessel with aneurysm, small swelling here. Okay, this we can treat by open surgery. We put a clip. It's
Okay.
called clipping or craniotomy.
But nowadays it become less. I mean, open
Yeah,
surgery
correct,
is
yeah.
less because hospital stay is long, and
Correct.
bleeding manner also become
Correct,
increases.
correct.
Okay.
So in that kind of cases, this is the results.
Okay.
So as I told you, in this patient there is one more aneurysm where we do a clipping, and then the clipping can be seen here. This is one way of doing it. It's cheaper. The other way is this one. See, there's a angiogram of this patient. There's a blood vessel. You can see a aneurysm here,
Okay.
sitting here.
Okay.
So in these patients, what we do, we did something called a coiling. We put coils through the inside of the blood vessels, and after the coiling, the aneurysm is not there.
Okay.
So this is something called aneurysm coiling. So this is the better method, but unfortunately this is also more expensive. So in Bangladesh, we have to always weigh the cost with the effectiveness
Cost
of the
problem
treatment.
is the main problem
Correct.
in Bangladesh. Actually, third world countries, there is a problem of the
Correct.
economical condition. Okay, so we are coming to the end of the show. So I want to know anything if you want to suggest for our audience.
The one main thing that I would suggest for the audience is that do not neglect stroke. If you have any problem, like any weakness that you develop in your hand or limbs, or you start feeling weak, please go to the hospital as early as possible. Do not waste your time trying to self-medicate you, self-treat yourself, and don't go to a local hospital, say smaller clinics and other things.
Because the CT scan only can be done in the well-equipped hospital.
Correct.
Okay.
Always go to well-equipped institutes where you have all the facilities where you can be treated immediately. And if you come to bigger hospitals where you can do a stent retrieval and inject, all the medications can be there, you can be, we can give the best treatment and you will be able to walk instead of being a burden for the family for the rest of their life. This is what I would want to tell them.
Thank you, Hari Prakash. Thanks a lot for coming to the show.
Thank you, Dr. Pauline.
সুপ্রিয় দর্শক, নিউট্রিচ ডায়াবেটিক বিস্কিট গুড হেলথ অনুষ্ঠানে আমাদের আজকের বিষয় ছিল স্ট্রোক এবং এই বিষয়টি নিয়ে আমরা আমাদের ডক্টরের কাছ থেকে যা